2025 to order. If you'll stand for the Pledge of Allegiance and a moment of silence.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Good morning, everyone. At this time, I'll call the Crow Wing County regular board meeting for August 12, 2025 to order. If you'll stand for the Pledge of Allegiance and a moment of silence. All right, at this time, we have the recognition of retiring employee Lori Thompson. Is there someone who will welcome to the microphone?
Oh, I'm glad I have my heels on. Otherwise, I don't know if I would have reached it. Good morning, Commissioners. My name is Hannah Jude, and I serve as the long-term care supervisor with Community Services. Lori, no pressure. Would you like to stand up here? You're welcome. Lori Thompson has served Crow Wing County for over 25 years, and her dedication, compassion, resourcefulness, and heart have been evident every step of the way. One client once said, Lori goes beyond and then beyond that with her follow-up, offering solutions to every problem I had. In fact, she found problems I didn't even know I had and helped solve those too. Another shared, I would change nothing about Lori. She is great. She makes sure I am safe and happy. These aren't just kind words, they reflect Lori's unwavering dedication to truly improving lives. Lori's actions speak just as loudly as her words. In one instance, she personally visited 2 police stations to help locate a client's personal belongings after his vehicle was towed. Just one example of her going the extra mile. In 2016, Lori was appointed to the Minnesota Board of Social Work, serving the state of Minnesota and the board with integrity and excellence. One of her client's success stories was featured in a health plan newsletter in May 2024, highlighting the outstanding work happening here in Crow Wing County. In addition, Lori has served her community through the pop-up pantry, Cross Lake Cares, and participating in the Alzheimer's Walk. Outside of work, Lori brings the same energy and passion to her personal life. She enjoys hunting, car shows, gardening, traveling, and spending time with her family, who are also active members of this community that she loves so much. Lori, your presence will be deeply missed. We thank you for your many years of dedicated service, your kindness, and the positive impact you've made on so many lives. We wish you all the best in this next chapter of life. May it be full of adventure, joy, and well-deserved relaxation. Congratulations, Lori, on your retirement.
You sure can, Lori.
Thank you. You always think about this day, and now that it's here, it seems a bit surreal. I came to Crow Wing County in January 2000 as an intern in the long-term care unit. Susan Mazenga was my supervisor at this time, and this is when social services was over where land services at now. I was hired just a few months later, and this was a leap of faith for me. I had worked for almost 15 years at Essentia, and we had 3 small daughters at the time. I needed to ensure that this was going to be a long-term plan for me. Well, 25 years later, here I am, and this turned out to be a good move for me. First, I need to thank my husband, Dale. He's been my biggest supporter when I decided to go back to college for my bachelor's degree and then my master's degree. I was working at that time, so he was the one taking care of our daughters, taking them to dance, softball, making their school lunches, taking them to church events. They rode in the tractors with him. He was the one to fix the meals when I wasn't there. I also need to thank my long-term care team. They're all in the back. 25 years, many of us have been on that same team. They've been supportive. When we had a tough case, there was always one of them there to help me out. MnChoices came around. We were there together. Thank you, team. And lastly, the MnChoices team. They've been so gracious. Thank you. It's been a pleasure to work with so many wonderful elderly members of our community, the over 65 population for most of my career. I've been in homes where there's been no furniture, and I've done the assessment sitting on the floor. And then I've been in other homes where there's just a path, and I've tried to find a chair to sit on. I've done assessments where there's more critters that have outnumbered the people. I've heard some beautiful love stories, and I've assisted with funerals where the client had no family. People in our community are so gracious and appreciative for the services that they can receive that will allow them to remain safe in their home just a little bit longer. It's been so rewarding to work with this group of people. I've been trying to figure out how many cups of coffee I shared with these clients at their kitchen table doing these visits and assessments. I figured I've completed over 6,000 visits and assessments in my 25 years working for Crow Wing County. Again, in closing, just a big thank you to my team and my husband. He thinks he's going to get me down at the main farm, driving one of those great big John Deere tractors or grain trucks, but I think I have a deer stand that's calling my name. Thank you all. Take that leap of faith and enjoy. Be kind.
Lori, if you come back up to the front here. On behalf of the Crow Wing County and the Board of Commissioners, I'd like to present to you the certification of excellence for the 25 years that you put in here, the 15 years you put in at Essentia. It's quite a career in helping people in Crow Wing County, so thank you very much for your service.
Thank you.
To your husband, Lori, my wife just retired, and to him I want to say your life won't get any easier. I'll just tell you that. All right, with that, is there anyone here who would like to speak to open forum? That's any issue that's not currently on our agenda. Anyone in the audience that would like to speak during open forum? Final call. Anyone who would like to speak? Hearing none, we'll move on. Number 4 on our agenda is to review and approve the minutes from July 22nd, 2025, and amend the minutes from July 8th, 2025.
So moved.
Motion by Commissioner Franzine.
Second.
Second by Commissioner Coring. All in favor signify by saying aye.
Aye.
Aye. Not in favor, same sign. That motion passes. Number 5 is to review and approve today's agenda. Administrator?
Mr. Chair, we do have one additional business item, a budget amendment for the Highway Department. If we could add that under additional business, please.
We will do that. Looking for a motion to approve the agenda as amended.
So move.
Commissioner Coring makes the motion to approve.
Second.
Second by Commissioner Franzine. All in favor signify by saying aye.
Aye.
Aye. Not in favor, same sign. That motion passes. Number 6 is our consent agenda.
Motion to approve.
Motion by
Second.
Commissioner Coring to approve, second by Commissioner Franzine. All in favor signify by saying aye.
Aye.
Aye. Not in favor, same sign. That motion passes. Number 7, Brainerd Lakes Area Airport Commission. Welcome, Mr. Yeager, Mr. Planzer, and Ms. Ruling. Good morning.
Good morning. I'd like to just take a second and thank you all for seeing us today. Mr. Yeager, do you want to say anything?
Just real quick as a point of introduction, this is the interim director, Neil Planzer, who came here, and we are honored to have him here to help us through the process of finding the next full-time director.
Well, yes, thank you. I have two functions when I came here. One is to make sure that the airport is running well and to find a permanent long-term director. Before I go into, we're here to talk about essential air services. Before I do that, I want to mention a couple of things about the airport that I think you all know, but I'd like to emphasize. As a community, we're very lucky to have that airport. It really is a jewel. It's very well run, it's very well maintained. The people who work out there have a great work ethic. There are limited numbers of people who work there. There are 6 people, including myself, that manage that airport. You have 4 operations men that work that airport, keep it open 365 days a year, every single day. And those are the 4 people that do a Herculean work. The glue that holds them together is sitting on my right, and that's Jessica. She really keeps everything flowing, and we're lucky to have her as well. The other thing I'd like to mention as a group, the commission that you have between Crow Wing County and the city of Brainerd is really, really well integrated. I want to compliment Commissioner Barrows, Councilman Yeager, and although he's not here, he's on vacation, Darrell Palmer. The 3 of them really, really, really work well together. We would make very little progress if it wasn't for the integration that they provide to us and the thoughtfulness and the input that they do. I wanted to make sure that I got an opportunity to let you know how lucky we are as a community to have both that commission and also the strong work ethic of the people at the airport. The essential air services is critical to the community. When they deregulated aviation in 1974, in order to ensure that communities like this one were able to maintain airline service, they created Essential Air Service. It is a federally subsidized program that allows the federal government to pay a fee to allow them to service the airport so that they are not in a position where they will come and go because of the flow of dollars going into the airline. They rebid that occasionally, and we are in the middle of what is a rebid for that services. And understand that we as a community don't choose who gets it, but we are, a critical part of it is the community telling the federal government why and which airline they want. There was 2 bidders, Delta through SkyWest, which is Delta Connection, and another one, Denver Air Connection, both flying back and forth, same route to Minneapolis, St. Paul. The fact that they were bidding against each other was very, very beneficial to us. Because of that, we were able to talk to SkyWest and tell them that in order to get the support from the community, we must have a morning flight return. Right now, there's a morning flight at 11. We told them that the community wanted a flight between 6 and 7 in the morning with a late return and the plane to remain overnight for that early morning flight. Why is that important? Well, if you have a medical need and you have a doctor and you have to go to the cities, it allows you to go back and forth the same day. That early morning flight, they can't do that now. If you're traveling to the east or the west coast of the United States, or even the international flights, either way, that morning flight between 6 and 7 allows you to get to the first bank of airplanes leaving from Minneapolis-St. Paul. So it is critical for the livelihood of the community that they reinstate that. The airport brings in about $30 million of revenue into the community and about 280 jobs in a study done about 3 years ago. So it may have changed a little bit, but it's pretty healthy. For our community, the airport is not only a jewel, it is a bargain, considering what we pay to run that airport. The majority of the funds that run that airport come from federal subsidies like the Essential Air Services and also capital improvements in a program called the Airport Improvement Program. In addition, the tenants at the airport pay about half the operating costs of the airport, and they provide quite a bit of revenue as well. So when you look at that community, you realize that the airport is valuable, but the Essential Air Services is really the key to the whole thing. So when the commission, the Airport Commission, looked at it, there were a couple of factors that I want to reiterate that were critical and why they chose Delta. One is Delta is a code share. The community generally understands, even if they don't know the phrase code share, what that means is it's seamless. They get onto the Delta site, they book their flights from Brainerd to Minneapolis, Minneapolis to their final destination if it's not Minneapolis. They see no difference. This other bidder did what they call an interline. Interline is not as robust as code share. So if there's a disruption to service, the interline has much less responsibility. The code share has a lot more responsibility, getting you on another flight, making sure that your bags are all taken care of. So the code share was a critical piece to it. Delta and SkyWest has served that airport for 12 years, and it is a pretty good service. Airplanes break, all airplanes break, and it doesn't happen often. They have like a 94% departure on time rate, which is pretty good. The other part of the continuing of service is the community understands how it works. If we were to change to another carrier, it would be my opinion and my history would tell you, and I've seen lots of airports, it's very disruptive. They won't understand why it's not Delta. They won't understand why they have to make 2 phone calls and not 1 phone call. So that the fact that we have the code share through Delta and they like Delta, there was a study done here in the Crow Wing County 2 years ago where the people overwhelmingly supported continuing with Delta on the earlier request for proposal to service this airport. So we considered all of those factors. What the airport doesn't want, what the community doesn't want is a disruption. So we want to continue with Delta, and the commission voted unanimously. The Airport Commission, I'm sorry, we got 2 commissions. The Airport Commission voted unanimously. We made this presentation on Monday to the City Council. It wasn't Monday, it was a Friday, I think.
Last Monday.
Last Monday.
Yes.
And they also voted unanimously to continue with Delta. Our only consideration in the determination of who gets the contract is through community involvement. So we have a letter coming from the City of Brainerd, and I sent the package to Debbie, and I have handouts that I can leave with you if you'd like to look at a paper copy. I'm a paper copy guy, so I like paper copies. And you can look at that. I also took the liberty of writing a draft letter that you can use to get started on. The key to it is that the letters must be to the Department of Transportation no later than the 29th. I think it's critical that we get them there earlier than that, and I asked Ms. Erickson to send me a copy of whatever letter you send, because I want to do it twice. You send your letter, and we're going to send all of the letters from the airport. We'll send all of them to make sure that they got all of them. We've got the opportunity to meet with Congressman Stauber yesterday, and Congressman Stauber was extremely supportive, to the point where he told his aide that this was his number one priority. He wants to wait until this council votes, so he knows that it's a unanimous community. The two commissions and the council unanimously agree to be supportive of Delta. The timing of the commitment was originally the 15th of August, and we weren't able to meet it because for reasons that I don't have to go into. We were not fully aware that it was even being rebid. So we called up and petitioned to get an extension. They gave us till the 28th. We can meet the 28th. We also have contacted a number of the larger businesses in the community, and they're also going to write letters of support. Our only input, other than phone calls, is that letter of community support. It is critical. And of course, Congressman Stauber's unwavering support of it is also very critical. He is on the transportation committee in the House, and that's very important to the DOT. So the fact that he's willing to support this is really, really, really important. I think if you have any questions, I can answer them. I think that pretty much covers at a high level what we need to do. If there's any questions or you want me to go into any depth on anything, I can do that. I don't want to waste your time. I want to just want to get your support.
So, Mr. Planzer,
Yes, sir.
for clarification, it's a 4-year contract that we're bidding, or being bid at this point, correct?
Yes, it is a 4-year contract, and that, let me give a little color to that, because I meant to do it early and I didn't. The Denver Air Connection bid is slightly lower than the Delta bid, but from everybody I've spoken to, an overwhelming support by the community will allow us to overcome the bid difference, and over the 4-year periods, by the end of the year, is only a $20,000 difference, which in the scheme of things is not very much. So we think that if we do a good job in our support, and the airport takes the lead in making sure all the letters get done and get sent there, then it'll be a 4-year contract.
So for clarification, what's being asked of us today in our resolution is to support SkyWest as the preferred provider, which has the co-chair relationship with Delta,
Yes, sir.
and that will become part of the record that we will send to the federal DOT.
Exactly.
Chair, move
Commissioner Corey?
the adoption of the resolution that's presented to us here.
Commissioner Coring makes the motion to approve the adoption as presented,
I'll second it.
second by Commissioner Lubke. All those in favor signify by saying aye.
Aye.
Aye. Not in favor, same sign. That motion passes. Thank you very much for all the work. To all of you, the staff out there, the City Council of Brainerd, we appreciate all of the efforts that have been made. I know the business community, the chamber is on board.
Yes, sir.
Sourcewell's on board. They've already presented a letter. So we have some regional partners in this process also. So thank you very much.
No, thank you. Appreciate all the hard work that this commission does, and I'm going to repeat by intent and not senility. I want to thank Commissioner Burrows, Councilman Yeager, and Mr. Palmer, who isn't here, who's the chair of the Airport Commission. We're very lucky to have a team that works so integrated. Thank you. And I should mention, Ms. Erickson took a big problem away from us with a great letter she wrote. I told her earlier I carried it around just because it's so well done. So thank you for that.
It was. So Thank you very much again.
Thank you.
Appreciate it. And with that, we'll move on to number 8, Community Services. Ms. Terry? Chief Garcia?
Hello, Mr. Chair, Commissioners, Kara Terry, Crow Wing County Community Services. Do you want to introduce yourselves?
Sergeant Joe Garcia, Breezy Point Police Department.
Good morning, I'm Maria Stevenson. I'm the Community Paramedic Supervisor at North Memorial.
So thank you for having us here today. We come before you with a pilot project idea, and we seek your approval. A little bit of history. So in May of 2018, the Crow Wing County Board signed a resolution to reduce the number of individuals with mental illness sitting in the county jail. As a part of the work around that, Community Services was able to partner with law enforcement entities as well as other community partners, and we embedded 3 social workers in the county jail to help alleviate some of those concerns. Fast forward a bit until, let me get my notes, 2022, we were able to complete a further iteration of the project in which we embedded 2 social workers into our local law enforcement. One social worker is embedded in the Crow Wing County Sheriff's Office, and the other is embedded in the Brainerd Police Department. These social workers have a number of focus areas that include screening, reviewing, and responding to reports that law enforcement receives, and go on calls with law enforcement when there's a mental health, substance misuse issue, or other community service needs. They do outreach to consumers and any collaterals involved in calls to evaluate needs for further assistance. They facilitate and integrate and mobilize those community resources to support those in the community who might be having mental health or substance misuse issues. They work with our mobile crisis team and our mental health urgent care to utilize those services when needed. They also assist with safety planning and stabilization, and then they communicate with our law enforcement contact on open cases in the community that they need to collaborate with each other. So law enforcement utilization, we know that the majority of the calls for our social workers come from, bless you, the Brainerd and Baxter areas. There are other calls, though, within the Crow Wing County community in other jurisdictions that our social workers do respond to. Sometimes it might take them a little while to get to those other calls because they are either coming from the Brainerd or Baxter area or are on another call and need to respond. But what we know is our coordinated community response total calls that our social workers assisted with in 2024 were 850. Part of those calls, 216 of them actually, law enforcement was cleared either partially or fully from those calls, so law enforcement could go deal with other important issues, leaving the social workers there to help the individuals that they were working with. I believe you've heard from our law enforcement partners on the positive interactions and the amount of help that both our jail staff and our law enforcement agencies are feeling from having the social workers embedded and to be able to respond. We believe that this pilot project, the Community Paramedic, is the next iteration in the overall project that we started back in 2019. As you know, mental health calls and issues continue to intensify. They continue to increase not only in the Brainerd-Baxter area, but in all parts of Crow Wing County. Issues with transportation for those outlying areas, as well as not as many healthcare opportunities or possibilities in those outlying areas also exist. And so we believe that two things. So looking at this work from a business perspective, we do not see the number of calls related to specifically to mental health and substance use disorder to justify having a social worker stationed in the northern part of the county and paid for by community services. We do know, however, there is a need for additional services in the northern part of the county. We believe a community paramedic could not only provide assistance with mental health and substance use disorder calls, but could also nicely fit into the 4 categories of our BLADE opioid work. So those categories include prevention, treatment and recovery, harm reduction, and the justice system. Our community paramedic would be much like our social workers currently, to be able to respond to not only mental health and substance use disorder calls, but any health-related calls, med management, for example, or other health-related issues that somebody might need help with. We know that 31% of our calls in Q2 were related to health issues. So not only would the community paramedic be able to respond to clients in the northern portion of the county, but they'll also be able to support other clients throughout Crow Wing County and our social workers who work in the field. Our social workers often run into health-related issues, and they have to refer to maybe it's Essentia or CRMC or other clinics, and then figure out the transportation to be able to get the individuals to those locations. A community paramedic can not only consult with our social workers, but potentially help with those medical issues in the areas in which the clients live. So I will stop talking and turn it over to my co-presenters. Sergeant Garcia, if you want to come in.
Mr. Chair, Commissioners, I appreciate you giving me the opportunity to talk today. I've never sat in this seat, so I apologize if I'm a little nervous. I know a lot of you, I've worked with you, some of you.
If I can just stop you, that seat isn't anywhere as impactful as the one up here. Oh, sure. So.
I appreciate that. I've worked with a lot of you, whether it's Commissioner Lee out on the streets in the trenches, or I had the honor, Commissioner Coring presented me back in 2007 with the Star Life Award from the Minnesota Legislature, which is still one of my greatest honors that I've had. Or Commissioner Lubke, when he was the mayor of Jenkins, I worked really closely with him and the Pequot Lakes Police Department. Some of you I've only met recently, Commissioner Barrows, and I'm familiar with Commissioner Franzine's work with the Mental Health Committee, which just underscores what her dedication is as to what we're talking to here today. This pilot program is something unique for the area, but it's not brand new. There are successful programs similar to this throughout the state. And this is really a bottom-driven and a trenches-driven initiative. We, speaking for myself and my colleagues in law enforcement in the area, in the northern part of the county and the central part of the county, recognized that there was a gap. We were dealing with increasing numbers of repeat 911 calls, increasing numbers of mental health calls, increasing numbers of those calls were related to substance use disorder. All of those things go hand in hand. Health problems, other health problems accompany substance use disorder. When you have those other health problems, those people utilize more and more of the resources. It won't come as any surprise to you that, law enforcement and EMS are dealing with a crisis of resources right now. I think you've seen the letter Cross Lake Mayor Purefeast put out about ambulance response times. And while that's not in my wheelhouse, what I can tell you in talking with people at North Memorial and stuff, every community paramedic that you have out there taking the medicine to the patients will have an ambulance available for those true emergency high acuity calls more often. Programs have seen 30% drops in repeat 911 calls across the country when they implement similar models than this. So I stand ready to answer your questions, but from a boots on the ground perspective, I don't see a better solution to some of the challenges we're facing out there today.
And I'll just note, that I did not mention in my initial comments, that this would be a collaboration between Crow Wing County Community Services. We would potentially, if approved today, fund the position through our opioid dollars. The position would be housed at Breezy PD, but would respond to the north and central parts of the county. And North Ambulance would employ the person and be responsible for training, equipment, that type of thing. Maria, do you want to speak to your portion now?
Yeah. Thank you for meeting with us today. A couple things. A lot of people have never heard of a community paramedic before, so I'd like to just kind of explain that a little bit. Community paramedics are paramedics that have been on the street for at least 2 years. They get an extra training, college training, that allows them to become more versed in chronic disease management, preventative care, all kinds of different things that we can do multiple things as far as medication management, home safety evaluations. We are able to help with resources. Resources are a huge thing for us. We try and connect people to the correct steps so that if they are struggling, they're not by themselves. We try and help connect those dots for those people, because if you've never been in healthcare, you have no idea how to connect those dots. We are able to help people that are struggling with substance use disorder get help with mental health, because a lot of statistics show that the mental health is the #1 reason for substance use disorder. We're able to help decrease the calls for the law enforcement officers that maybe they don't need to respond to necessarily. Throughout the state, we have 3 different models that we employ for community paramedics. In the metro, we do a non-emergency appointment-based response. So we see patients in their own homes on a scheduled basis. We get these referrals from the hospital, clinics, and from the ambulance. And then also in the metro, we're working with Brooklyn Park and Brooklyn Center Police Departments on an alternative response team. These teams are a community paramedic and a social worker, and we're responding to 911 calls. Most of those calls are going to be for welfare checks, mental health calls, disturbances. Dispatch the teams are dispatched out of the county. The county dispatch goes through the pre-arrival, making sure that the scene is safe. If the scene is safe and no officers are needed to respond, the team is able to go. That is freeing up officers from responding to calls that they wouldn't have to. And then we have a third model, which we use up in Grand Rapids. That is it's a community or county contract that we work with the counties. And this community paramedic is seeing patients from Adult Protection Services and CPS, APS, and the CPS, so that if the team is on the scene with a patient and they feel that there's some kind of medical needs, medication management, a physical assessment, does this person need to go to the ER, our community paramedic is able to respond. With this model, this project, we are looking at combining a little bit of all of them. So it's going to be unique to fit the Crow Wing County needs.
Anything else?
We got all sorts of stuff we can share with you, but we'll wait for questions. How about that?
Questions?
Absolutely.
Commissioner
There you
Lee?
go. I got all sorts of questions for you. What is these other pilot programs that are around the state, are they all with North?
Correct.
Okay. And what kind of success have they had and how long have they been doing them?
So the Brooklyn Park started 3 years ago. They have expanded. The first alternative response team started as a community paramedic and a social worker during the daytime hours. They've switched now where they have 3 teams. They have the art team 1, which is the community paramedic and the social worker. During the day, they have 2 social workers in the evening that do response, and then they have 1 social worker that works more with PD on as a co-responder on the more dangerous situations where support is needed.
And I think after their first year, in Brooklyn Park, the alternative response team, I think they responded to 800 incidents, that one team, and reduced mental health related 911 calls reduced by about 20% from about 1,300 to about just over 1,000. So.
Okay. What would this paramedic position be offering that our embedded social workers aren't able to do, and then keeping them from a trip to the hospital, that type of stuff?
So it's a new concept for me, so I have to do a lot of research. I just, this morning I talked with one of the North Memorial medical directors who oversees a community paramedic program, and he kind of helped reinforce my knowledge. They can do point of scene care. They can help, we're talking about opioid dollars and opioid addiction, substance use disorder. Sometimes those conditions are managed with medications, Suboxone, things like that. The community paramedic through the medical director can assist and potentially site prescribe those addiction medications. They can, in times of mental health crisis, they can administer medications right at the scene, and then further evaluate the patient to, if the crisis is done, put them in touch with a mental health provider, either through the Northern Pines urgent care, their own personal mental health safety net, or do the transport, thereby freeing up an ambulance. The community paramedic can actually do the transport. Social workers, as great as they are at connecting people with resources, don't have the ability or the scope of practice to do medication prescriptions, medication administration, wound care, and other health assessments like that.
Okay. How would this person be scheduled? I mean, it's obviously one person that we're talking about, so how would they be scheduled?
I think needs drive operations. I think that's the way to go. I think, it would start out as a co-scheduling with the hours that our mental health social workers and the dedicated mental health deputy are on, and then we would track and on a regular basis. I would assume that community services would track the needs and adjust the schedule as necessary.
And to Sergeant Garcia's point, we've done a lot of evaluation on the social workers embedded, and we found that, while mental health calls don't necessarily come in between 8 and 5, that would make our lives a whole lot easier. We do rely on our mobile crisis outreach team to provide after-hours services. We contract with them to provide those services, and our embedded social workers are doing an amazing job, not only during the day responding, but following up with our mobile crisis outreach to hear about what happened during the evening hours or overnights, and then following up on any of those calls. So we would see our community paramedic potentially, at least initially, operating on those same hours. We also have expectations for the community paramedic, if you approve the position, to be a part of our mental health screenings that take place with local law enforcement a couple times a week. So the group gets together to talk about what cases they have, what they're hearing, what ICRs they've received. We would expect that that person would be a part of that group, as well as being a consult for our social workers for our adult protection cases that may have health-related issues or other health-related concerns that our social workers need a resource for.
Okay. And then, how long do you expect this pilot program to be a pilot program, and how are you going to be evaluating it?
So we would like to have a year worth of time to be able to get a sound evaluation. If you were to approve the funding today, I think North has a timeline to bring the community paramedic on board in January. Is that right, Maria?
Correct.
So it'd be a January to January pilot. You can see in our project definition that I submitted, we have our expected end results of the effort. So how will the world be different if we're implementing this information? Or the expected end results that we have outlined here will help us outline and define our goal areas. I also see the goal areas to be quite consistent with the social work goal areas that we have. So we track things like the number of calls, the number of mental health issues on the calls, substance use disorder or health-related issues, the number of calls that our law enforcement can clear from or partially clear from, the number of community connections that individuals make, including, hopefully, with a primary care provider in the future because of community paramedics' work. So we have a number of different outcomes that we'll measure. Our supervisor over this team, Morgan, does a really great job in tracking all of the data, and I would see the same tracking to occur both with us in community services and with our partners in this project.
Okay. I guess the two concerns that I have, one is, as a guy who worked nights, there's always, like our embedded social workers now are daytime employees. This position is most likely going to be that, or at least an overlap with days. So my concern is what happens on nights and weekends. What are we doing with that? And then my second concern is, maybe you guys can elaborate on this, but my understanding is what's happened with Cross Lake is partially due to a staffing issue. Is North even going to be able to staff a position like this?
I can respond to the first concern. We do partner closely with our mobile crisis outreach team. Our social workers actually did ride-alongs with them to ensure they understood their process. They understood ours. And so we rely on mobile crisis outreach to do the after hours and on weekend calls. If you want more information on that, we have our team here to be able to respond to any more in-depth questions that you have related to those kind of questions. And then Maria, do you want to speak to the staffing?
Yeah, one of the things that the community paramedic would be able to do is follow up after the call too. But the community paramedic is going to be separate from the ambulance, but they're still employed with North. It's a separate program.
You have a couple staff who could potentially take that role?
Correct. There are multiple community paramedics in the area.
Okay, I think I'm good for the moment.
Commissioner Coring?
Thank you, Mr. Chairman. I have a lot of constituents that watch this meeting, and either live or later on, because I get emails from they ask questions. So first question I have is, could either Kara or Debbie Erickson, can you explain, when we say, oh, it's going to be paid for with the opioid dollars, I think people that might be listening go, well, what does that mean? Mm-hmm. Can you just explain that there was a lawsuit and just where that money's coming from? Because I think they're going to want to know.
Absolutely. So At the federal level, there was a lawsuit related to the opioid epidemic nationwide that held drug manufacturers and distributors, sounds not as, not a better term to use, responsible for that opioid epidemic. So companies like the Sacklers, CVS, Walgreens, all of those different businesses that profited from the opioid epidemic are now being held accountable through the court system at the federal level and have to pay settlement dollars to the states. The state of Minnesota has an agreement with the federal court system that Minnesota will receive some of those dollars through the federal opioid settlement. Counties then have an agreement with the state, with the Attorney General's office, on not only the amount of money that we'll be receiving, but the requirements by which we must follow to allocate the money. So these are federal court dollars from manufacturers and distributors of the opioid epidemic that are being held accountable. And then we utilize the dollars here at the county level to be able to impact what we've seen from the opioid epidemic. Does that help? Debbie, you want to add anything that way?
The only thing I would add, Mr. Chair, Commissioner Coring, is that the dollars are estimated until we actually receive them. So we know an estimate of, based on who the settlement agreements have gone through with, what that amount would potentially be coming to the county. We get notice of settlements that occur a few months before we get an actual payment that happens. So it is a projection, but we don't know what those actual dollars are until we actually get the money from those settlements.
Correct.
That's helpful. Mr. Chair, another a question. So if you look at and thank you for the documents that you sent last night, Kara. The documents are on what our responsibilities are as far as spending the money. It's pretty vague. It's very vague. So what happens then is it's up to because each commissioner is elected, they have the decision of how they interpret how the money would be spent. And so we have the opioid coalition that's set up to filter some of this stuff out before it gets to us, where we make the ultimate decision. So the question is this came, and I must have missed that meeting, but this came through the opioid committee. It was a unanimous decision to move this forward?
It was not unanimous, Commissioner Coring and Mr. Chair. The vote actually of respondents, the outcome of the vote was 18 to 14, 18 in favor and 14 not in favor. Those not in favor votes included staff from community services as well as community partners, many who are here today. The way we have things laid out with our opioid coalition since its inception is that it's a democratic process. The majority of times we have a unanimous vote, but this time we did not, and we respect the concerns that were shared from those who voted no and look to how do we improve the project based on their concerns.
And then, Mr. Chair, so I guess, obviously, this is just my decision. Everybody else makes their own decisions, but and not that you guys you're talking about great work, and it's absolutely great things. But I guess the way I kind of look at this is I interpret it as prevention. How do we prevent people from getting on opioids or getting on drugs? And I don't see, a lot of times when these things come forward, I don't see a whole lot of prevention. It's almost like after the fact. And I interpret that the money is really, the lawsuit was really to kind of for prevention. And I don't see any prevention in this. I understand that we have lots of problems with mental health and there's just a lot of troubles out there, but I look at this, the paperwork that you sent last night, this almost, just this pilot project, the cost of it would use up almost 2/3 of the opioid dollars in what you're projected for 2025, or if it was 2026, it's like 2/3 of the money would be used just for this alone. So I just, in my mind, I'm sorry to say that I'm probably going to be a no on this, because I don't feel like it meets the criteria that I think that money should be used for, and that's prevention. And so I apologize for that, but I just, I don't know, that's my thinking on it, unless somebody can convince me otherwise.
So, Mr. Chair, Commissioner Coring, I appreciate this concern. You do bring this up, a prevention focus at each of the projects, and when we bring those forward to you, or grant applications at that time. So I appreciate your consistency. It gives me an opportunity to think ahead before coming here to speak with you. So in terms of prevention, that is one of the 4 categories that the Opioid Coalition, the Blade Opioid Coalition, developed. So it's prevention, justice system, harm reduction, and treatment and recovery are the 4 areas that our Blade Opioid Coalition decided were top priority areas and areas in which we could utilize the funding. Granted, this came about in 2021 or so, 22, when we started initially having the discussions around opioid funding. But in terms of revisiting with our existing opioid coalition, we are still behind these focus areas for the dollars. In terms of prevention from a community services standpoint, what we see is a lot of generational substance use disorder issues. So mom and dad use, kids think it's okay to use, and then they utilize substances as well. Where we see this position as potentially having an impact on this is impacting those families with kids in the northern and central part of the county, to be able to interact with those individuals who are facing substance use disorders. So hopefully influencing the children's choices that they make through seeing the community paramedic interact with their parents or their significant trusted adults. A community paramedic is a lot friendlier of a face, not that they're friendlier, so to speak, but a perceived friendliness than a child protection social worker, for example, or even a law enforcement officer, for example. So we see it through a community services prevention lens of impacting those kiddos who might be on the calls. Sergeant Garcia, do you have anything to add?
I guess, for me, it's being proactive in treatment and intervention. Community paramedics go to where the crisis is occurring and can put those people, deliver harm reduction measures, but also put those people, those generationally impacted, in touch with support services and stuff in hopes of, we break that cycle. So when you talk about the prevention, justice, harm reduction, and treatment and recovery, this is, the community paramedic is putting people in touch with those resources right now, and not, waiting for the DARE program in school or waiting for that. I think if we look at the efficacy of traditional prevention programs, I think we can all look at the state we're in as far as substance use disorder, specifically opioids, and realize that the traditional approach, how we're doing it or how we've always done it, hasn't worked. And we need to come up with, I don't think we should ever stop looking for better ways to protect our community. I think as a citizen and of Crow Wing County, it's incumbent upon us to advocate for new and innovative ways and look at, okay, if what we're doing now doesn't work, then what are we going to do in the future? We should ever stop looking for better ways to...
Mr. Lepke?
Since I'm kind of like the numbers guy, I look at this 160-some thousand coming out of the opiate funds. I'm definitely okay with going out there and being out there as a program. I think that's really important. I think it is another level, instead of having, like you said, an officer coming out there or a child protection person coming out there, which kind of comes out there as authority. It's coming out there more as, I'm your liaison to get you connected. I'm not here to judge you, I'm here to do this. I have a daughter who is a licensed alcohol and drug counselor and works in harm reduction. And it's been really hard for me to understand what harm reduction is. And she has helped me to understand the fact that harm reduction is getting people back on with their life versus in jail or in some place where you can't find them. So I'm supportive of it. I questioned, the only thing I questioned, because it's a pilot program, I'm always worried about the one-off. Okay, we're gonna come next year, this is $161,000, this is a lot of money. And we're gonna come, how is it gonna be funded next year? How's it gonna be funded the year after? That's my question more than anything else. I support what you're doing. I know your work, officer, and you've done excellent work up in our neck of the woods, so. And I know North York has done really well, and I do have an officer, a niece who's an officer down in Brooklyn Park, so I know what you guys are doing down there, so I support it. Mine is, it's coming from the opiate funds. Where are other communities getting their funding for this? You know, that's, you know, because there's other programs out there. Where is it coming from? Is it coming from regular levy dollars in those things, or safety dollars, or is there other grants out there to help fund this as we go on with this program?
Maria, I don't know if you know the funding source for the counties you're working with?
I don't specifically. I do know that they are using some funding dollars, but I'm not sure where the rest of it comes from.
My understanding is in Hennepin County, they're using a combination of grant funding, levy dollars, and I don't know the status of their, because theirs is more mental health focused. I don't know that they're using opioid dollars, but through some of the Justice Byrne grants and public safety grants through Minnesota DPS and Federal Department of Justice.
So we utilize a number of different grants for our positions. Tammy Lewick thinks I use the Adult Mental Health Initiative grant too much. Maybe that's true, but it's a good funding source. So we would look at other grant opportunities during the course of this pilot project. Perhaps Sourcewell would have some dollars if this is successful and could go regional. I'm not sure yet, but the pilot project would help us to get some data and information under our belts to be able to apply for other grants. Currently, or at the end of 2024, our year-end balance was $931,000. To Commissioner Coring's point, we anticipate future projections to be around the $252,500. That opioid pot of money isn't going to be there forever. And so if we truly value this, we're going to figure out a way to be able to fund it. Much like we've done, I think, with the ARPA positions that we were able to continue to utilize in finding those areas where we could reallocate resources. We're going to do the same thing with these positions or this position that we would with any other position that we find value in. Keep in mind, we are not the ones employing the staff person, that's North. So we're going to have to potentially get creative with our funding, but this year gives us some time to figure that out. And we may come in front of you in a year's time and say, we find X amount of value, and would you consider funding again? Or we may say, well, that was a flop, or that wasn't as successful as we thought it would be. Not that I'm sure it won't be that, because we have Sergeant Garcia and North working on this, but if it doesn't work, then we don't fund it.
You know, it's already been proven there's a need for it. I mean, this goes way back years ago when it was first talked about mental health, when it was first talked about with, I think it was the chief of Baxter got involved in it and through some pilot program, and it's taken off from that. So I see the need out there. Again, in our county, I don't think you're gonna have, like maybe in some of the metro areas where you can focus just on one, whether it be mental health, whether it be.
Right.
So it's gonna be kind of a potpourri of going out there for different functions. I mean, I do support it. I would have a heck of a time coming back here next year and asking for the opiate funds to support the whole thing again.
Yes.
I would have a real challenge with that.
I appreciate that.
Since we haven't done it here before, it is a good place to get the funds from to do it, but I know there's some questions, you know, these are opiate funds. And I don't want them just to be, oh, it's a low-hanging fruit, let's just grab it from there and not look and come back and say, oh, next year, let's grab it from there again. I couldn't support that. I can support this and try it, but I can't support using the opiate funds as our only funding source from ongoing.
Thank you.
That's my opinion. Thank you.
Well, I feel the same as Commissioner Lubke. This is a one-year program, in my opinion, and we'll see how it goes if it passes, and you'll have to come back next year to see if we will go on.
And I anticipate coming before you, even before that, to give you an update, and we can do that at any point in time. You know, first quarter might be a little rough. We probably won't have a lot of great numbers, but maybe 6 months in, we can come in front of you and share information about what we're seeing currently. Happy to do that as well. I just volunteered you guys. Hope you're okay with that. So, awesome.
Couple things. I have to recognize myself.
Yeah, who are you?
First of all, going back on the funding from the opioid dollars, to allow the public to understand that the dollars that come into Minnesota, the counties get 75%, the state gets 25%. We don't know what the state's doing with their 25%. We only know what Crow Wing County's doing with their 75%. And those dollars are front-loaded, so we're getting more dollars early on, and over the course of, is it 18 years? It's a declining scale that we'll be getting that. So when we think of to Commissioner Lubke's point, how do we, the one-offs where we're investing today, and how do we carry on to be impactful into perpetuity is the issue that we're dealing with. So we know there are also some additional lawsuits that are still pending out there where additional dollars may be coming, hopefully so, but they may not be as large as some of the initial lawsuits that the companies lost. So my question is, you referenced, Sergeant, the mayor up in Cross Lake and the response times for an ambulance. Is this position going to have its own vehicle, first of all, and how will, the answer is yes?
Yes.
And when I look at the communities that this individual will be serving, have you done any compilation of response times out to those outer ring of, because they're being housed in Breezy Point, but you're talking about Cross Lake, you're talking about, you know, Lake Edward Township. What's the response time for that person to get there versus what North is doing?
Sure. To speak to that, I think the ambulance response time and the community paramedic response times are two separate things. What I think the most impact the community paramedic has on response time, that generally they're not going to be responding in an emergent fashion. They're going to be, you know, urgently responding to people in crisis. But their primary role is not that of your typical street ambulance paramedic. What they will be able to do is free up ambulances from going to these low acuity, non-medically emergency calls and allowing more ambulances to go to those higher acuity medical emergencies, whereas the community paramedic will be able to respond to those low acuity calls such as, you know, mental health crisis. So instead of staging an ambulance in the area, the community paramedic could respond. Instead of sending an ambulance to a lift assist, the community paramedic could respond. And evaluate that patient and decide, and make the medical call. Does this person need an ambulance? To an opioid overdose where Narcan is administered and now the patient is refusing, that community paramedic can go and evaluate that patient and put them in contact with a healthcare provider instead of tying up an ambulance, which that patient will ultimately refuse transport oftentimes. So from Breezy Point to the outer, to answer your question more directly, the question you did ask is, from Breezy Point, you can get to the outer reaches of that geographical area, target geographical area, in probably 30 minutes or less anywhere there. But I think the biggest impact that the community paramedic program will have is on freeing up ambulances for emergency response. From Breezy Point, you can get to the reaches.
So I think that's where kind of the question presents itself. Is this about medical, or is this about the opioid use? And I know medical is one of the things that you identified as the 4 buckets where these dollars can be used, or mental health. But when we're only talking about response of an ambulance, we're not necessarily narrowing it down to mental health and opioid or substance abuse issues. So that's where I start to kind of question and get cloudy in my thinking on the funding. Then, Ms. Lewick, would you like to speak?
Could I please?
Yes.
So I know the funding piece keeps coming up, and I just want to make sure everybody understands that our 2 embedded social workers are funded through our Adult Mental Health Initiative through the Region 5, as well as an Office of Justice grant. To start this program in the jail, we got a DHS Innovations grant, and then we got Sourcewell grant. This last year, we had a Sourcewell grant. We have had to work really hard at diversifying our funding for this project because this isn't something that's just paid for. We can do there's an office-involved care coordination program that we could be claiming, and it's very difficult for us to even do that. So I just want to speak to, this is bigger than just a community paramedic. The idea, what they were doing, or what they are doing down in Brooklyn Park, is they're bringing a community paramedic in with a team of social workers, and we also have our mental health deputy coming from the jail, which I believe is funded through our sheriff's office. So, I just want to make sure that we understand that this, I know you're looking at the community paramedic as being fully funded by the opioid dollars, but the opioid dollars does not, this is the first time we've actually really tapped into the opioid dollars for this team. So just wanted to make that clarification.
So to that point, and I'm going to be very pointed to North Ambulance, this is your employee. Same thing we get faced with ARPA dollars and that. What are you going to do in year 2 when we don't give you $161,000? Have you, our group has done a great job of trying to figure out different pots of money to cobble all this stuff together. You guys haven't been in, at least that I understand, that world as much as we have at Community Services. So what would be your approach?
The community paramedic would be able to fall back onto the ambulance if needed in the area, but we will be contracted.
So you'd be contracted with this individual?
No, with the count.
I'm not following that.
I think what she said was that paramedic, if they employ one person for this position, they would likely get an internal candidate. And then that candidate, if this position wasn't funded and the position went away next year, that person would be able to reintegrate into North Memorial Health back into their previous position.
And one of the things we've got going for us, Commissioner, is this collaboration. So any grant applications that we complete, we have a lot of history behind completing grant applications, and Tammy and her team have done a great job in finding other funding sources. And B, this collaboration with our 3 partners coming to the table makes any grant application even stronger, as long as we can demonstrate the effectiveness. So to your point about utilizing the opioid funds for this work, we recognize that there are not enough calls associated with mental health, substance use disorder, the type of calls that our social workers are currently responding to in the Brainerd-Baxter area. We also recognize that those calls are increasing, however, and there is a strong need for response in that area. And there's only so much that our 2 social workers can do. I mean, they're pretty amazing individuals, but they're only able to do so much. So how do we continue to build on the program that we have with our social workers? And we believe that a community paramedic, like I said initially, is the next iteration of that work. So not only can the community paramedic work with our social workers to make those connections to important resource needs, but then they can also help with medication management for the substance use disorder or help with medications for a mental health crisis. And they can also help our social workers with our adult protection cases. They can help with some of the property assessment, the public health nuisance cases, potentially if there's a medical component to those. And they can help just support clients in general up in that section of the county. We believe strongly that this would be a very beneficial add to our Crow Wing County Community Services. I forgot our acronym, Morgan, I apologize. The law enforcement liaisons work. I'll just say that.
So back to North Ambulance. You're going to dedicate one of your current employees to this position, funded by opiate dollars. How's that impacting your schedule? You're taking one of your workforce employees away from ambulance response to put in. Are you flush with these people?
We're constantly looking to hire. We've been trying to do that. This person that will be with this program will be dedicated.
And it's my understanding you would potentially fill that role that would be vacated by the community paramedic moving into this program, fill that position. Is that right? That would become open when you
Correct.
move a community paramedic, so they would hire for the
Hire,
vacancy that would be created in moving a position to the community paramedic work.
Similar to us then. Year 2, the dollars go away. Is this person going to reapply to you folks? Or are you just going to say goodbye? And
No, they would be reabsorbed back into the north in Brainerd area if they come from Brainerd.
So is this cleared with your senior management that you have? I see a head shaker back there.
That's Eric.
So they understand what's going to happen, and it'll become North Ambulance's responsibility if in year 2 there's no dollars available.
Correct.
Mr. Chair.
Kurt, I'm not done yet. Thank
Okay,
you.
when you-
Clarify for me, when it comes to mental health, and who, and Sergeant, you also, who does that initial assessment, whether it requires an ambulance response or, because it's my understanding when the bells go off, everybody shoots for that spot. That's a pretty simplification of the way the system works, but so do you call them off then? But they've already responded, so they have an expense that's been incurred. Clarify for me how this is going to work and how this is going to diminish the ambulance response
So
opportunities.
During the hours that the community paramedic is on, dispatch will be able to kind of weed those out. They're able to ask certain questions to see if an ambulance response is needed. If the officer believes that an ambulance is needed above the community paramedic, if the community paramedic is responding also, then they could either cancel the ambulance if they're not needed or request one if one isn't being sent also.
And I think some clarification, or maybe just because I don't think a lot of people know how dispatch works as far as medicals go around here. It's kind of confusing mess because it depends on where in the county it happens. But for the target geographical area, let's say my grandmother falls and she doesn't think she hurts, but she hits her medical alarm, right? And they can talk back and forth with her, and she says, I don't think I'm hurt, I just need help, I can't get up. They call Crow Wing County Dispatch. Crow Wing County Dispatch, depending on where it's at, will send the local first responder group, the local law enforcement group, and then they transfer the call down to Brooklyn Center to North Memorial Ambulance. All medical calls in the county go down to North Memorial for pre-arrival screening and instructions. And that North Memorial Dispatch determines what level of response to send and whether to send that emergent or lights and sirens or without lights and sirens in routine. And then they dispatch, if it's in North Memorial's area, they dispatch the North Memorial ambulance. If it's not in North Memorial's area, then then Crow Wing County Dispatch will dispatch the other ambulance service. Usually in Crow Wing County, that's Cayena Regional Medical Center ambulance out of Crosby Hospital. So dispatch, both can do the pre-screening and realize, okay, this doesn't need a full ambulance response. We can look at our status board. We can see we have a paramedic on duty, a community paramedic on duty up in that area, and send the community paramedic. The community paramedic will also have a radio monitoring all of the dispatch traffic, both for North Memorial and for Crow Wing County, and be able to triage some of those calls, his or herself, and self-dispatch to calls he or she feels are appropriate. And also police officers, first responder groups, and even other ambulances can request the community paramedic respond.
So, to you, Kara, you mentioned 850 calls originally in your presentation. How many of those were in the Brainerd-Baxter area versus the outlying areas?
Oh, my goodness. Have I got a deal for you? So we can see that, let me take my glasses off, for law enforcement utilization in the Brainerd area, and Morgan, is this for 24? Yes, thank you. So in 2024, 380 of the calls were through the Crow Wing County Sheriff's Office. 292 of the calls were through Brainerd PD. And then all of the outlying jurisdictions, so Cross Lake was 107, looking at my colors, Pequot was 12, Nisswa was 6, and then so on and so forth. So all of the other smaller agencies are those additional calls for 2024.
So two-thirds are in the Brainerd-Baxter area, and one-third is not confined to that geographic area, because there's still a huge part of Crow Wing County that's not being talked about. So the eastern part, the southern part, we would split that other third, correct?
So less than half, just looking at this pie chart, less than half, so about 393 were, less than half were Brainerd-Baxter. So about, if you say about half, 50-50 are county.
Local PDs.
What was
Local-
you said
and local
380,
PDs.
and then you had a 292 number?
Yep, 380s for the sheriff's office specifically, and then the 292 is for Brainerd
Okay,
City.
so 380 would cover the whole county then?
Correct.
Under the sheriff's?
Yep, and then the smaller law enforcement agencies make up the rest of the
Okay.
numbers there. I can provide you with this data too if you want a copy of it.
No, you clarified it for me, so I understand that. I think that's the end of mine. Commissioner Lebke, you had some more?
You know, we're going down kind of into the weeds about all this. You know, we don't know what this program will bring until we try it. You know, we don't know all the needs that are out there that we never hear about. The neighbor that picks up the guy and brings him in because he's not going to go in an ambulance. Somebody else that's dealing with pain management and has gone through their whole prescription that they have for a month in 5 days, and is doing what, we don't know any of those things yet. I am supportive of doing this as a pilot, but I definitely want to be looking at it 6 months into it and see if it's something that's going to sunset or if it's something else that we're actively looking for other funds for, because I do not support this being an ongoing funding from the opiates. I think it's just like we're doing in I've sat at a lot of the different Blade meetings. I sat at the one that last Friday, when everybody went up and made their proposals.
Yep.
You know, they've tried it. They've got some stuff working. They're coming back and asking for more funding. They're showing what they've done. They're presenting it. Then that coalition supports that, and then it comes to us for final approval, if that's the way I understand it.
Yep.
I believe that should be the same thing in here. I can support it, and I will make a motion to support it, but I definitely want to see it come back in 6 months or a year, because if it isn't working, let's not be funding it.
Yes, sir.
And find another, and if it is working, let's find some other funding sources other than the opiate. So,
I do have one additional question. You mentioned in Brooklyn Center, Brooklyn Park, it's a team that goes out. So it's this individual and it's a social worker. So they have a team that's approaching the situation. We have one individual, although we have the support of community services, social workers and that, but they aren't on scene. Does that give us comfort in what's taking place at the scene?
Operationally, I can speak to that. There again, the community paramedic will always have a radio that if he or she feels that they need additional assistance, whether it be from a social worker or from local law enforcement or from the dedicated mental health deputy with the Crow Wing County Sheriff's Office. For example, let's say EMS the previous night resuscitates an opioid overdose with Narcan. One of the goals, and I think one of the measurables of the program, would be to, within 72 hours, have a community paramedic follow up with that person, try to put them in immediate touch with treatment needs, treatment resources, safe housing, things like that. That is something that can be scheduled either as a co-response with a social worker or the mental health deputy or local law enforcement if it's in one of the smaller jurisdictions. If it's a health screening, say it's someone who's repeatedly called 911 for varying health concerns, which is something we see very frequently, people who are disproportionately utilizing 911 resources. Maybe they go out, maybe the community paramedic, maybe it's my grandma because she falls 6 times in 1 week, right? And she's disproportionately using those 911 resources. Then the community paramedic can probably go do that assessment and screening on his or her own without any concern. But those other maybe different types of experiences, that's what's so great about this being a team and a partnership, is they will have the resources to go with a social worker if it's determined. They will have the ability to go with law enforcement if it's determined, and vice versa, right? Maybe the mental health deputy is responding to a person with an intractable anxiety attack. Our community paramedic can go administer some medications, bring that crisis to an end, and further evaluate and put that person in touch with the resources they need. So yeah.
The expectation, Commissioner, that we've laid out with our project group thus far is that the community paramedic would be an integral part of our co-response team. So they would participate in meetings, they would build relationships, they would go out on calls together if need be, they would be communicating back and forth. Frequently, our law enforcement liaisons have radios as well, so there would be an expectation that that person would be a part of our community services team ongoing.
So one last thing.
No, he's got one too.
Okay. So my question is this, Brooklyn Center, Brooklyn Park, how long have they been doing it?
3 years.
3 years? So they do have data on their response. Now, again, going back to my previous concern is they have a team that responds, but clarify why their data, their results weren't included in the justification for this position.
So Brooklyn Park, Brooklyn Center, North has that data.
Okay.
Our program, while we aren't reinventing the wheel completely, will be different than what Brooklyn Park and Brooklyn Center have. We're not the Metro, nor do we want to be. And B, we're creating this as it fits for Crow Wing County. So Maria has the data here, if you'd like to hear it, but we didn't include it in the packet because it's not going to be the same program, for example.
Understood, but it would, since we haven't done anything here similar to this, it would seem that that would be just something to cue us into what
Yeah.
potentially could be the results.
Yeah, the project team has used it. Maria has shared it with all of us, and so I apologize I didn't include it in the packet, but she can share it right now if you'd like to hear it.
So the date range is January 1st, 24 to 6/30 of 25. Between Brooklyn Park and Brooklyn Center together, our art team has responded to 228 events across 156 individuals. 175 of these were listed as mental health, and 50, which is 76.8%, and 52, 22.8% were mental health / substance use disorder.
So they don't deal with psychotropic drugs though, do they? This individual that you're going to hire?
Can you clarify that? We do have some medications that we are able to administer that our art team does carry, such as,
So if the individual has a prescription, they could,
we
and
can
they,
give
and you know, have
our-
knowledge that they've been out of that medication, could start that? Is that a doctor's order that's required for
So with
that?
our medical director, he is able to prescribe medications if needed on an emergency basis. But as a paramedic, we have standing orders with our medical director where we are able to give out some medications also. So we would be able to give like anxiety medications and stuff on the scene
So
immediately.
injectables versus pill?
All of the above.
Both, yeah. Yeah,
Okay.
we carry a complement of oral and injectable stuff.
So you're driving a pharmacy down the road with that
Much.
ambulance. Commissioner Lee?
Okay, Mr. Garcia, you were discussing the dispatch tree. Tell me what happens when that community paramedic is not working.
So when that community paramedic is not working, it would go very much the same as it does now. With the current response, yeah.
Okay, so he wouldn't be getting called out or anything like that?
No.
Okay. And I guess the last biggest question I've got maybe is for you, Ms. Terry. As you were rattling off those numbers, I was adding them up, and that was 125 for 2024 for that area that we're talking about, the pilot area. We're talking about $161,000 for a year, and maybe we won't do it after that, but help me explain to my constituents how I can justify $161,000 for 125 calls.
Can I?
Please.
I can speak to that from an operational standpoint. Sometimes if you build it, they will come, right? Oftentimes we know how busy the law enforcement liaisons are, and sometimes because they're so busy, we don't even request or utilize them because they're not available. And so, and obviously, this is just my projection, but I project, based on my knowledge of working in law enforcement in that area for the last 20 years, that if we had a resource that was closer and more readily available and focused on the issues that we're seeing and the gaps that we've identified, that they would be utilized more than that 120 or 126 times. I forget the number you said, but yeah.
Okay. From my background, I understand why this would be a great thing from the law enforcement standpoint and the paramedics that are working the rigs. I get that 100%. And I'm new to this board, so maybe I'm not reading the tea leaves right the way everybody else does, but I think everybody's kind of can see the need, but are really struggling with the price tag and where we're going to end up in a year from now. So it's I don't think it's going to be an easy decision to make. So.
And to your point, Commissioner, we don't come, and Mr. Chair, we don't come to you often with pilot project ideas. So we've been vetting this since March as a group, and we didn't bring it to you until now because we had to really think through it and make sure that the use of the opioid dollars was initially the right way to go, make sure we had all of the right people at the table. And we don't want to throw opioid dollars at something that we don't believe is going to be successful either. So that's why we're here today with this vetted pilot project to ask for this support. It's because, and if it's not successful in the year's time, we won't do it anymore. And I think Community Services has demonstrated that we, if things aren't working, we adjust to either make it work or we don't do it anymore. So I just said that.
If we vote to move it forward, I hope it's extremely successful. I hope that's what we would want it to be. Otherwise, there's no sense in sitting here talking about it. What I'm concerned about is a year from now, when it is successful, then we have to make a decision on how we're going to fund it, and that screams levy dollars to me, and that's a scary thing. So how do we get past that?
And to Tammy's point, we've been really creative in finding our funding sources, and so I don't see that going away in terms of our creativity and funding. We still have AMHI dollars too, right, Tammy?
Mr. Chair.
I'm done. I'm done.
Okay.
Commissioner Locke.
And I believe it's going to work, and I will make the motion to support it. With that same thing, concerned about how it's going to work. It is a pilot program. We're using opiate dollars. Coalitions and collaborations do cry out for other funding, and when you go with that, and if it is a collaborated effort and it's working, I hope you're looking for those funds long before we get to this time next year where we're trying to see how we're going to fund it again. So,
Absolutely.
so I make a motion to go
Well,
ahead and.
if I can, before you do that, Brian, tell me, Kara, for this proposal, did this follow the normal process for all the other individuals or groups that were presenting? Did it follow the same process, and was it vetted the same way?
So it wasn't vetted in the same way that the grant applications were vetted. So I know you were both there at the grant application meeting where I did a mini presentation of sorts, and Sergeant Garcia also talked to the project. I sent out an email outlining the project detail with the project definition to the coalition and asked for their consideration that way. This was just really poor timing in terms of our grant application process. So we didn't have another meeting to bring it to before we had to move on it to be a part of North's budget process that they have going on. So we were under a bit of a timeline crunch with that process as well as our budget process. And in the past, we have not followed, as a Crow Wing County Community Services Agency and the Sheriff's Office and the jail, we have not followed any sort of grant process like our community providers have for requesting funds. And we do bring it to the coalition to let them know, but we do not go through a grant process for requesting funds for community service, sheriff's office, or jail projects. As you know, or you may have seen in the MOA with the Attorney General's office, public health is the chief strategist over these dollars. And so it's our job as public health to go out and seek ideas or areas of funding, and then gather feedback from our community members. And so as a chief strategist for the dollars, we bring our county stuff to you directly and inform the coalition. So we kind of follow a different process than we normally would, if that makes sense. So it followed the normal process like we would for a community services, sheriff's office, or jail process.
Okay. Mr. Andrews?
Yeah, thank you very much. First and foremost, 12, 13, 14, 15, 16, 17, 18, 19 people died while we've had this conversation today from opiate addiction. North Memorial saved my life when I overdosed. Crow Wing County Community Services also has been a part of me being sober and to be able to give back to the community. But when I'm looking at the process, is it a need? I support it as being a need. The presentation you guys got today, I would have loved to have the coalition be able to hear that whole presentation. It was 11:14 on July 24th that we received an email the night before the presentation. So we come in, 184 was the ask in the email, 184,000 as we are contending for, as 22 organizations, $200,000. So it was hard, number one. Is it worth the effort? Yeah. Should we know more about it? Yeah. And as I listened to the presentation, I'm still asking myself where is the information that supports us in a way that helps people be able to understand that the people that died ahead of this, that this money is attached to, that it is honoring them. It's answering the future. It's a responsive action towards towards the people that you're serving. Everybody sitting at this table, I support them in this action. To come here today, I think maybe I got 2 hours of sleep last night because I questioned whether I should say anything or not. But to speak for the people that can no longer speak, I have a requirement and a responsibility. To speak for the representative of the community, I have a responsibility to come before you guys today. And to say, do I support this possibly moving forward? Yes. Today, no. I believe that needs to come back before the committee, have this discussion, let this team answer the questions, because I don't think they're all answered yet, but to be able to answer the questions that support, help us to understand that the outcomes as a county and as a community is trying to achieve, that this is the best use of the dollars. I have a whole outline here to go through, but the fact is that the important part is transparency, best use of funds. The 6-day time window for us to respond and give an answer for this vote. Out of 143 people that received the email, 18 and 13, I would say that not enough people know about it yet. And so I know it's a different track. There's 2 tracks. I think it needs to be a clear process so that the county and the community services and everybody is working together as a collaboration and a unified county. This action and this fast track, and I know it was good intentions from everybody involved, but it starts to cause questions. And I think that's where we're at. If the position isn't until January, and if it's been talked about since March, my question is why did we just find out about it? And if it is vetted, and I believe that they have done their work, but they haven't presented it to us as a coalition. And I'm here today as a member of the coalition and a member of Crow Wing County. This is our home. We need to represent the people the best way possible. But we also want to make sure that people aren't questioning what we're doing in actions. And that's why I'm here today. Thank you.
Thank you. I know there's some things that we do where we don't have outside groups that attend our meetings to understand what we're doing with the Sheriff's Department or the County Attorney's Office. We do have those opportunities that take place that don't include a lot of community involvement. So And this apparently is one of those that gets done in a different manner, but because it sort of comes alongside the opioid dollars, feels like this group has been disenfranchised from understanding or knowing what's going on within the county itself. So I understand, Brian, your position, and I understand the coalition's position, but the county does have other missions, I'll say, or directions that we go, and sometimes that just doesn't feel comfortable, but it's true that we do that year after year after year, so it's not unusual for us to be in this position. With that, are there any other questions? Look for a motion to approve or deny.
I make a motion.
Table?
I make a motion to approve the funding for this pilot program for 1 year for the community paramedic collaboration.
Lubke makes a motion to approve the opioid funding in the amount of $161,198 to be paid to North Memorial. Let me hold back one second.
Could I have a little bit of a range, 161 to 175? North hasn't finished their union contracts yet or their negotiations for salary, so I am not sure what the amount is going to be yet. The 161 is based on 2025 wages?
Correct.
So it won't be a huge increase by any means, but
Well, 161 to 175 is a lot of money. But
We're done. I'm going to ask you to take your motion back and consider one to table at this point.
Yeah, let's table it.
Okay.
until we know North's.
Yes,
Until we get all the
that's a good
information.
idea.
Until this
I
other-
will take my motion back, and since there wasn't any second, we don't have to ask, and I'll make a motion to table until we get a final number.
Commissioner Lubke makes a motion to table.
Second.
Second by Commissioner Franzine. All in favor signify by saying aye. Aye. Those not in favor, same sign. That motion passes. It'll be tabled until we get further information.
Thank you.
Thank you for your presentation.
Move on to number 9, Land Services, Mr. Pence. Thank you. A second on that.
Good morning, Mr. Chair and Commissioners. I have before you today a citizen petition to consider amendments to the land use ordinance. I'd like to introduce Steve Zielinski. Steve was the one who made the application and is requesting that the county consider amending our current land use ordinance from allowing commercial cannabis cultivation in the rural residential 5 and 10 land use districts with an interim use permit. The Planning Commission Board of Adjustment did consider this request at the meeting, at their meeting last month, and they made no recommendation to the county board and forwarded that on to you for your consideration. Just a couple things to consider is that the county board did amend the land use ordinance back on December 17th of 2024 related to regulating commercial use of cannabis. The ordinance amendment updated that all cannabis uses, which related to cultivation, manufacture, process, retail, and wholesale, must be located in a commercial, waterfront commercial, or the airport district. And all cannabis uses require an interim use permit. Mr. Zielinski reached out to our department to inquire about the ability to cultivate cannabis on his property in Oak Lawn Township, which is located off of County Road 25. Mr. Zielinski has been growing hemp through the Department of Agriculture on this parcel in the past. The current zoning on the property is RR5 and is surrounded by the rural residential 5 zoning. The nearest commercial land use district is approximately 1 mile north on Highway 210. And so what he's asking is for the county board to consider allowing the commercial cultivation of cannabis in the rural residential 5 and 10 land use districts. He did include some information in the packet to you located on page 116 and 117. If we could just, Amber, if you could turn to page 122 of the packet just to show what the changes, how they're being proposed. This is where you can see where we currently have the uses listed this is in our Table E of 10.3 of the land use tables. You can see where it says cannabis cultivation commercial. Right now, it is an interim use in the commercial and in the waterfront commercial land use districts, and he's requesting that it'll also be allowed as an interim use permit in the rural residential 5 and 10. Just included in your packet as well, I just did a quick little bit of research for the meeting and just looked at what do some of the cities, this will be on page 126 of the packet, just what are some of the local cities, how they're handling cannabis regulation related to both retail and cultivation. And you can see that most, generally speaking, the cities are following the counties, are not following the county, but we're in alignment, I guess. The difference would be that Pequot Lakes allows cultivation in their forest management and agricultural zoning, which would be similar to our ag forested district that we have. But everybody else is either having that cultivation retail both in commercial or in some sort of an industrial district. I would be happy to answer any questions. Otherwise, I'd turn it over to Mr. Zielinski, and he can explain where he's at and why he's making the request this morning.
Commissioner Franzine?
I have a question. You said it's a petition. Is this a petition like the ditch petition where one person?
No, it's the way the ordinance reads when it talks about it's just a citizen. He's making an individual, just the one. It's just
that's what I
him alone.
What I
correct.
wondered.
Yep, just him alone.
So he hasn't gone around and
no,
gotten
this is just
anybody's-
it's just him himself.
Okay.
So, Mr. Zielinski, if you would like to make some remarks, you're certainly welcome to do that.
Yes, first of all, I'd like to point out that, of course, in a city, you're not going to want people growing it in their yard or anything, so that's why they did that. But when we're talking about the county, we're talking about rural area. I just want to point out that this has been a long process for us. We've been working on this for 6 years, since 2019. We have since got a license pre-approval from the state of Minnesota to have a micro business, which allows us to grow 5,000 square feet of indoor cannabis. And we have a permit from the city of Brainerd to open a retail, but we just need to be able to grow. And now we're in a point where we've gotten to this point, and in 2024, when they came to you and OCM came to you and said, what are you going to do? And nobody even knew what was going on yet. Now we know that it's very micromanaged. We have been vetted. We have been through the ringer just to get to the point we are. From security to our employees have to be vetted and background checked. It's going to be very micromanaged. So I'm coming to you saying, can we loosen the reins now and find a way to grow on our own property rather than having all the restrictions of growing in a commercial area in Crow Wing County, which is basically the only place we can grow right now. We can't grow in the city because of the water. The water's chlorinated. It is a agricultural crop. It has to have good water. We're not asking you to just open it up to 5 and 10 acre lots. Is there a way we can look at, if you have a large amount of property, that we can actually do what we want to do with our own property? So in a nutshell, I'm coming to you saying, is there a way we can loosen the reins and keep this local, keep us in our community, keeping the integrity of what we've done with our businesses in the community, and move forward with that?
Questions for Mr. Zielinski? So Chris, one question, if we would change this for Mr. Zielinski, does that change it for all RR5s across the county?
Correct. Yep.
Do we have any way of carving out that property, like grandfathering, or, because I'm assuming you had permission from the state to start what you did. on your
Yes,
property.
we've been working with the state for 6 years. We've had a hemp license through the Department of Agriculture, Minnesota Department of Agriculture, and then when the OCM came along, that got transferred to OCM, and we had to give up our hemp license to apply for a cannabis license. All the way along, we've been working with the state, and we got to the point where we even have a building ready to go. And then in 2024, they asked you, what are you going to do? And you said, well, we're not going to let nobody do nothing on their own land. We're going to go to the commercial land. And now that
You haven't built a building yet.
we have a
Or
building.
you have a
yes.
building, and so you invested in that.
Yes, I've invested, and I'm not asking you to give me any leeway personally. I'm here for the whole community if we can find a way to.
I think what I'm getting at, though, is the state created a mess.
The state
Initially.
created a big mess.
And so the county, we do what we do with land use maps.
Right.
And the state made a decision, and individuals like you made a decision, business decision, and.
Correct.
And here we are today, where what our land use is conflicts with what the state was allowing before any consideration of what counties might be doing in terms of their land use. Would that be correct, Chris?
Mr. Chair, County Board, the state of Minnesota gave counties the ability to regulate the location, place, and timing of, of these uses. So,
Okay.
so that's what our ability is to be able to say, what's the proper zoning district, what's the proper permitting, those sorts of performance standards is what the state gave the counties authority to implement. And so when we did that process back last December, it was at that point, the board had talked about, I think everybody was pretty clear, retail, all those sort of things should have been, were pretty clearly in the commercial. And then cultivation was also put into that as well. I know we had talked at some point about should cultivation maybe be allowed in the agricultural, forested area, potentially as a zoning district.
Right.
But it was decided at that point that to incorporate everything into that, into the commercial or the waterfront commercial, particularly related to cultivation and that. And so I think it's important to know that as was mentioned by Chair Barrows, that it applies, to Mr. Zielinski's property is currently zoned R5, and it's a 20-acre piece of property, and it's located over in Oak Lawn Township off of County Road 25. We did the updated comprehensive plan last year, and then we made some changes to the zoning map. He was still R5 prior to the comprehensive plan. At that point, there was some land that would have been to the west of him that was zoned agricultural forested at that time. But as we made the change, we looked at that and said that we thought that made more sense in that area to be residential in nature and maybe not agricultural. Not that you can't do agricultural practices you can still farm and do those sorts of things on the R5, generally speaking. But the county carved out and said they really felt that cultivation was appropriate at this point, at least, to be in that commercial, in that waterfront commercial land use districts that we have.
And remind me, we had a public hearing about that.
We did. We had a public hearing. We had public comment. We had all those activities.
So, Mr. Zielinski, did you attend the public hearing?
No, I
Or
wasn't
did you make
aware
any
of it. I'm
comments
sorry.
about what we were proposing at the time?
I did not know that.
Okay. So,
Can I,
no other question? Go ahead. Sure.
is there no way to put a limit on the amount of land you own to be able to do this? Like, we own 40 acres and we're out in the middle of nowhere. Is there any way to adjust what we're doing, is what I'm asking? Allow it in 5 and 10, but you must have 40 acres and you must not be by your neighbor. And I mean, what we're talking about is a building, enclosed building with security cameras, and OCM is watching what we're doing, and we're in the middle of nowhere. We just want to be able to use our land as we wish to use it.
I'm going to say respectfully today, I don't think this board's ready to make any kind of change like that, I think there would have to be a lot of discussion with Land Services and Chris and his group to look at any possibility that might happen. And I think, if I'm not mistaken, your group has already, Chris, your team has looked at what's possible and what isn't possible, and currently it's not possible. Is that correct?
Not possible to, with the current way the ordinance
To
reads
grow in
today.
RR5.
It's not allowed use in the RR5.
Right.
That would be
So
correct.
it would require, if what he's asking for, we'd have to go through another public hearing. It's a change of a land use map, is that correct? And then it would impact every RR5 in the county.
It would, and regardless of if we make any future changes to this, it would still have that, countywide effect. I mean, if it was something that the board was interested in, you could give direction, and we'd then have to go look at Article 15, which is the article that deals with the performance standards for cannabis use within the county. And then if you wanted to say we can allow it in the R5 or maybe the R10 as well, but the minimum lot size is 40 and it has to be grown. I mean, those are some things that would be considered if that's something that, it's not something, that I would say staff on this are probably neutral. I mean, I would say it's this policy decision that if that's the direction that you wanted us to go, we could definitely put some drafting together and put that out for public comment. So, again, this is not a staff-driven request. It's coming from Mr. Zielinski,
So Administrator Erickson, so his request is coming to us because we make the final decisions on the land use map. Is that correct?
Correct. His request, Mr. Chair, is coming to you. He made through the petition process to ask for a change to the ordinance or amendment to the ordinance. The PCBOA heard the request at their level first, chose not to make any recommendation on the particular ask. You obviously are the final authority on any amendments to the land use ordinance, so that is why it is before you today. And if you are interested in directing staff to look at what potential changes could be, they can look at what that is, as Chris pointed out, through that process, or you can say you're not interested in any amendments at this point in time. From the cannabis perspective of things, the statute 342.13 tells you, like Chris said, you get to regulate time, place, and manner, or location, whatever that might be, as long as it is meeting what your current zoning ordinance is. And that was the process that we just went through last year.
Okay. Preference of the board? No preference?
Mr. Chair, and to the
Mr.
county
Coyne?
administrator, do we need to take any action, or if no action is action, or what would you say as the parliamentarian?
Because the request is before you to consider the amendment, I believe, if I remember what the statute says, that you do have to consider it. So it's either, I would say you need a vote up or down on whether you would approve the petition, yes.
So directing, in essence.
Directing staff
directing
either,
staff to-
yes, you should make changes, or you would deny the petition for amendment change, or amendment to the ordinance.
So, for
Direct staff,
clarification.
clarification. If you want to consider what Mr. Zielinski is asking you to consider, if you want to consider making changes to allow for cultivation in RR5 or 10, you would direct staff to consider amending Article 15, look at bringing considerations for Article 15 to allow for that to occur. If you are not wanting to consider it, you would vote to deny the petition for land use ordinance amendment.
Well, Mr. Chair, I just think we're like, I mean, we've made a lot of changes to our ordinance, and we're only 8 months into this change, and all of a sudden, we're gonna change it again. I guess I'm really hesitant. I understand what Mr. Zielinski's up against, but we don't even know how this is all gonna shake out, really. I mean, we're only eight months into it, and now we're being asked to change it already. I think sometime we got to leave these ordinances to see how they're working, and then if they're not working, then change them. But 8 months in, I guess at this point, I'm not ready to make any changes. So I would, appropriate motion would be a motion to deny the petition.
For land use ordinance amendment.
That's my motion.
I have a motion on the floor to deny. Do I have a second?
I'll second it.
Second by Commissioner Lee. All in favor signify by saying aye. Aye. Not in favor, same sign. Petition is denied. Thank you.
Thank you.
Ms. Fisher. Good morning. Still
Good morning,
right?
Mr. Chair and
Morning, Ed.
Commissioners. I am Amy Fisher, the Human Resources Manager, and I'm here this morning regarding paid family and medical leave, also known as PFML. This is a new unfunded state mandate that will be effective January 1st of 2026. On April 22nd of 25, the County Board of Commissioners authorized a request for a proposal process to obtain plan design proposals and pricing quotes for a private plan to administer the county's PFML. Integrity Benefits conducted the RFP on our behalf, as well as on the behalf of numerous other city and county entities throughout Minnesota. 5 companies responded to the RFP, with MetLife submitting the most favorable proposal at a payroll premium rate of 0.79% compared to the state's 0.88%. If selected, this rate is estimated to save approximately $37,000 in premium. MetLife's proposal also includes a 2-year rate guarantee dependent on the county utilizing some of MetLife's other insurance products. To be eligible for the 2-year rate guarantee, we received quotes on MetLife's short-term disability and long-term disability plans. The county's current short-term disability plan is self-funded, and the plan through MetLife will be a voluntary plan paid 100% by the employee. MetLife's quote on long-term disability is estimated to save the county approximately $14,000 in premiums. Choosing a private plan also does require the county to be responsible for a fee of $1,000 paid to the state for being on a private plan versus on the state plan. MetLife has experience with the administration of a paid leave plan on a large scale, and combining our other leaves, such as short-term and long-term disability, makes for a seamless process for our employees. So they're just submitting their leave paperwork to one place, and they're processing it for the short-term, the PFML, and then if it continues on to be a longer leave, the long-term disability as well. So if there aren't any questions, I'm asking us to authorization to enter into a contract with Integrity Benefits and MetLife for PFML, voluntary short-term disability plan, and long-term disability effective January 1 of 2026.
Commissioner Lee?
The $1,000, is that annual? Excuse me, annual?
It's just a one-time application fee with the state for getting approval to go with a private plan.
Okay, thank you.
Mr.
Commissioner Lubke?
So that you're saying the savings is approximately 37. What is the actual cost of this paid family medical leave that's the employee's going to pay part of that premium and the county's paying part of that premium, right? It's mandated by the state for us to do that?
Correct. The state, or the employer has to pay at least 50% of the premium.
Okay.
And I'll be working with our labor partners and stuff to talk, do the 50-50 split with employees on there. So approximately 50% of the total premium would be around $177,000, which is slightly less than 0.5% of levy.
So the employees are going to pay $170-some thousand. We're going to pay, the county's going to
Correct.
$170. So it's
Yep.
costing over $300-some thousand
Yes.
for this
Yep,
unfunded mandate from the state.
correct.
Okay. That's all I need.
I'm glad I'm not a state senator anymore, because I'd be getting beat up here all the time.
You would be. Yes, you would be, sir. But you were a state senator. Yeah. Thank you for reminding us.
All right. If there's no other questions, I would look for a motion to approve entering into a contract with Integrity Benefits / MetLife for the paid family and medical leave private plan, and the voluntary short-term and the long-term and the disability, or long-term disability plan, effective January 1, 2026.
I'll make the motion as long as I don't have to repeat what you just said.
Commissioner Lee makes
And
the
I will
motion
second it.
to approve, and Commissioner Lupke seconds that motion. All in favor signify by saying aye.
Aye.
Not in favor, same sign. That motion passes.
Thank you,
Thank you very
Commissioners.
much. That takes care of 10.1, 10.2.
My second item is the appointment of a new county attorney to fill the upcoming vacancy. The County Board of Commissioners previously accepted the resignation of County Attorney Donald F. Ryan and declared a vacancy in the office of Crow Wing County Attorney effective September 12th, 2025 at 4:30 p.m. Pursuant to Minnesota Statute 375.08, the Crow Wing County Board of Commissioners has the authority to fill the vacancy in office by appointment. The County Board has taken cover letters and resumes from interested internal candidates. After reviewing the cover letters and resumes submitted, Assistant County Attorney Kelsey A. Hops has been selected to serve the remainder of the term vacated by County Attorney Donald F. Ryan effective September 12th. So I'm just looking to approve the resolution appointing Kelsey A. Hops as the County Attorney effective September 12th, 2025.
Mr. Chair.
Commissioner Coring.
Mr. Chair, first of all, I want to publicly say thank you to Kelsey for stepping up and wanting to do this job. I mean, there could have been a chance that nobody wanted to do it, because it's not. It's a challenging job. It's a very challenging job. Murders, rapists, there's all kinds of stuff that normally people don't have to deal with on a daily basis. So it's a challenging job, and so as you move forward into this job, at least from me, I'm hoping that I'm a tough on crime kind of guy. So I'm hoping that you will do the same, because you have an awesome responsibility. You have a lot of discretion. It's kind of like a police officer. They pull you over. They can give you a ticket. They can give you a warning. They can give you a verbal warning. It's their discretion, and you have the same discretion. I think about Mary Moriarty, who's the county attorney for Hennepin County, and thank God she's not going to run again. But I think about this guy that scratched, I think, 5 or 6 Teslas, and it was about $20,000 in damage, which really was a felony, but put him on a diversion program. And that's where I say that there's so much that a county attorney can either charge or not charge. But I'm just so glad that you accepted the position. And I think back, because I can remember when the county attorney's office was one hell of a mess. And I think it was I was trying to think of his first name, is Stephen Rathke. Stephen Rathke was there, and it was really a mess. And then Jack Graham ran, and it was really a mess. And thank God we had Don Ryan, who stepped up, and Don Ryan has had a steady hand for the last 30 years, and there was no drama there. And I wish you all the success in the world, and I'll be supporting you wholeheartedly. And if nobody else has any comments, Mr. Chair, I would move the request for board action to fill the attorney, Kelsey, to fill the vacancy that was put forward by Don Ryan.
Second.
We have a motion by Commissioner Coring, seconded by Commissioner Franzine, to support the resolution appointing Kelsey Hops to the county attorney position. All in favor signify by saying aye.
Aye.
Not in favor, same sign. Congratulations.
Welcome, Attorney.
Congratulations, Kelsey.
County Attorney.
Thank you, Commissioners.
Thank you, Amy.
Are we going to appoint the sheriff now, or, oh, there is a sheriff.
County Sheriff.
Let's depoint the
Oh, this is a
sheriff.
long one today there. Good morning, Mr. Chair and County Commissioners. Appreciate the opportunity to be before you today. I'm going to tell you a story here. A couple of weeks ago, I ended up in the emergency room twice in 1 week because I had an allergic reaction. I got stung by a bee on Monday, and then I got stung on Sunday morning, and then I got stung again that week. And I ended up in the emergency room on 2 different occasions. I was in crisis, but it wasn't life or death. And I just, when I went into the emergency room and had my time there for a couple hours, they treated me really well. And I really appreciated that. When you're in crisis, you want to be treated like somebody really cares about you. And I did get that when I showed up in the ER. And it kind of just reminded me that a lot of the people that we deal with are in crisis. And that's why we have to provide that wow factor to them, because we want them to leave having a great experience with us when they're in crisis. So that's a kind of a reoccurring message that I keep telling our staff. And we celebrate these wow factor moments when we provide exceptional service, and we want to share that with others so that they can also personify that when they're out and about in our community as well, so when they're dealing with crises. So that's just a side note. This week we have BIR this weekend. It's actually started, they opened up the gates on Tuesday to let people come in and set up camp early just to try to relieve some pressure that's on our roadways. And so far so good with that. If you guys are interested in a ride along or coming out to BIR to take a look at what's going on out there or how they operate, please get a hold of one of our staff. We'd be glad to give you a tour out there so you can see what's going on. With that, I would certainly take any questions or concerns or compliments that you may have.
Any questions?
It's good to see your shirt is white today.
Yes. He brings that up because we had the fair, and we had, you've heard of Touch a Truck, and I wear this, I always have a nice white shirt, and I had all these people coming up and, patting me on the back, and it seemed like everybody was always trying to touch me and get my shirt dirty. And I just so next year, the guys were talking about having a Touch a Sheriff.
I think it's a good idea. We need a motion for that?
No.
All right.
All right, thank you.
Thank you. County Attorney, it's your first chance to speak.
Good morning, Mr. Chair, members of the board. I don't have anything today besides just saying thank you very much for this opportunity. I'm super excited to step into this new role and continue the momentum that Mr. Ryan has pushed through for 31 years. And just looking forward to working with all of you and working with and for the people of Crow Wing County. So thank you very much.
You're very welcome. Well deserved. County Administrator.
Mr. Chair, Commissioners, a couple of items for you. First of all, our senior management team did meet yesterday. We had a very robust conversation on a number of different topics, including social media and communications. Darcy reminded us that she is a resource available for any of the assistance that's needed there. And we also talked about having some backups for her. We just went through severe storm season here. Well, we're probably technically still in it, and we probably will get some more. But we want to make sure that we have some folks who are available to help with some of those community posts to get the word out to folks without Darcy feeling like she can never be on vacation or away from her desk or phone either. So we did talk about some opportunities for other folks in our organization to assist in that regard. We talked about some potential training partnerships with CLC for some technical hands-on how-to training with things like Excel or Power BI or some of our software training needs that we might have there. So we are working to see if there are opportunities for us to partner with them, similar to how we had done in the past. So it's kind of reviving a process that we previously had in place there. Because it is budget season, we continued our discussion of the 2026 budget and finalized the information that you will all be seeing on Thursday at the Budget Committee meeting. And then we had a good discussion around our performance management process, and as we begin the redesign of what that looks like, we made some commitments as a team of how we are going to proceed with completing that process and then supporting it as it moves forward. We're looking to spend about a full day here coming up in early September to have senior management work through the final processes of what that would look like as well. And then finally, we just talked a little bit about grant opportunities that come our way and how, as a senior management team, we can work to make sure that all areas are being considered for when those potential grants come up as well. The other item I have before you today is the lease agreement with the Crow Wing County Fair Association. If you recall, this is a 10-year lease agreement that we own as the county owns the property that the fairgrounds are on and lease the property to the fairgrounds for that purpose of utilizing it. The contract is a 10-year contract with consideration of $1 for the entire 10 years. That term is up again here coming up in January of 2026. So we are looking to amend or to agree to entering into the contract between Crow Wing County and the Crow Wing County Fair Association to extend the lease for the term from January 1st of 2026 through December 31st of 2035.
Commissioner Coring?
Just a question. I know that way back, a long time ago, I used to be on the fair board, and it was the Crow Wing County Agricultural Society, and I see it's a contract with the Crow Wing County Fair Association. I would assume it's the same thing, or have they?
It is the same thing.
Name change, okay.
Any other questions? Not, I'd look for a motion.
Move the lease agreement.
Commissioner Coring makes the motion to approve.
Second.
Second by Commissioner Franzine. All in favor signify by saying aye.
Aye.
Aye. Not in favor, same sign. That motion passes.
Thank you, Commissioners. Mr. Chair, that's all I have today, unless anyone has any questions for me.
Any questions for the administrator? Seeing none, we'll move on to number 14, Mr. Bray.
Mr. Chair and Commissioners, thank you for allowing me to add this agenda item under additional business. It's a budget amendment. Normally, we would go through the budget committee process with this, but we are asking or seeking approval for this budget amendment right at the board to seek an opportunity to advance one of our projects. And I provided a packet for you that has a lot of the background information. The short version really is that in May, the city of Baxter and representatives from Sourcewell came forward asking for a delay of a portion of our County Road 170 project, which is scheduled for next year. During that meeting, they requested that we consider an interim fix or a shorter term fix as they do their planning. The Sourcewell owns some adjacent property there. And in that meeting, you gave the County Highway Department direction to seek that interim fix. And after that meeting, we went back to the office and modified our plans for 2026 for the reconstruction and the resurfacing of 170 to include a thinner overlay that was expected to last much less. The concern from all of us was, would we spend a very large amount of money on a thick, long-lasting fix only to be tore up later as Sourcewell and the city of Baxter developed that area. Since that time, we have been made aware and received some advice from one of the industry experts on a process called microsurfacing. This is kind of what the name suggests. It is a thin surfacing, and it is not completely new to us, but we have not fully utilized it, but other counties do and the state does and things like that. The advantage of doing that is it lasts the same amount of time as we were going to do with the overlay, the interim fix, but it's at a much cheaper cost and with the same life expectancy. So we thought it's really good. And going from that normal overlay process of this is saving about $20,000, and we can move it up 1 year, and that's the basis of the budget amendment. The money that we were going to spend on that interim fix in that area, we were going to do in 2026. The budget amendment is to allow it to do it this year. Currently, the city of Baxter, it utilizes seal coating process on their roads, and after we had received the information from the industry expert, we asked if the city of Baxter would allow us to kind of join their contract this year to take care of that. And they have agreed, and they are going to start within a couple weeks. And so again, kind of a short timeline. And again, the advantages are we do deliver to the public this year, almost a full year in advance. We save $20,000. And there's an added benefit because we are considering if microservicing, that process is a strategy that we want to continue on, and this will act as a very good short test section for that. And so there's a lot of advantages to it, and I'm asking for your approval for the budget amendment for 2025 budget to advance this project.
Questions? Commissioner Coyne?
Mr. Chair and Tim Bray, so question, just a difference between a seal coat. I've seen the seal coats where they spray on and then they put, if people have seen the small rocks that are on there.
Yes.
What's the difference between the seal coating and the micro,
Sure.
whatever it is?
They look similar, but they have different functions. Seal coating is really to keep the water out. That's it. It does have a very thin layer of aggregates sprayed on and then covered with a fog sealing or an asphalt seal coat, I guess. Fog seal, we call it. What that does is really try to work to keep the water out, maybe seal up the cracks, and water, of course, is one of the things that damages our roads the most. It doesn't do a very good job at all of improving the ride quality. Think about these roads and all the defects. There are cracks that have cupped out. There might be rutting where trucks have compressed the asphalt over time. And so those don't get fixed with that a seal coat. It just kind of covers them up, paints over them. And the microsurfacing does the same thing, but it also is thick enough and is resilient enough to fill in those surface defects. So not only do you get a sealed roadway, but you also get a smoother ride, and you can improve that quality of the user too. It is a little more expensive, but you get a lot more benefits out of it as well. And it's one thing that we explored years ago on County Road 32 over by the Aiken County line. I don't know that we used it in the right application, and it was something that we did not continue. That was kind of a pilot as well. We're kind of back at the table. The technology has changed since probably 14 years ago when we first did it, and we're ready to try it again on this 2/3 of a mile to see if it's something that we'll come to you to ask you to adopt as a strategy as we continue to protect the investments we make in our infrastructure.
Commissioner Lee, did you have a question?
I had a question, but while you were talking, I found my answer, so I don't.
Yeah, I did. We didn't, Amber. I sent Amber this packet, and there's a map and the original letter from the city of Baxter, and then also that difference. There is some literature, Commissioner Coring, about the differences between microsurfacing and seal coating and their costs.
So if there's no other questions, I would look for a motion to approve.
Mr. Chair, motion to approve can you put that back up there? Motion to request for board action, budget amendment to advance County Road 170 surface treatment from 2026 to 2025.
Motion by Commissioner Coring, second by Commissioner Franzine. All in favor signify by saying aye.
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 Those not in favor, same sign. That motion passes. Thank you, Tim, very much. Before we adjourn, I would like to, do you have a comment?
I just want to, just to comment, if you remember on Monday, I got a couple of constituent calls and you know, always try to take care of those. And I just want to publicly also thank the county engineer for, you know, all of our staff. It's absolutely amazing how quickly they get after things. I had a gentleman over on County Road 10 it's the north side of Borden Lake, where it's a 30-mile-an-hour zone, and, you know, the bad thing is about us getting great roads is everybody starts going really fast. And so they're barreling through there, and I called up Tim, I believe it was on Monday afternoon, and by Thursday, we had some temporary, those signs that show what your speed is. By Thursday, his staff already had them out there. I went and ate out at JJ's Bird's Nest, and I drove through there. I made sure I didn't get the signs to start blinking at me. And so I want to thank Tim for that. And then I also want to thank Gary Griffin. You probably saw that sign that I had on Monday. It was the Lake Stewart program that a couple of the great people down at South Long Lake are trying to get a buffer zone down by the edge of the lake to keep silt and everything from running to the lake. And so people have to fill out an application, and then the two people that are in charge of that, volunteering to do that, then they give them a nice Stewart sign. And they asked if we could have one of those to promote that program at the little South Long Lake Park. And I called up Gary, and he said, yeah, I think that's a great idea. So we were down there on just this last week and put that sign up, and had a lot of positive comments on Facebook. So just wanted to let the board know that I'm not on vacation, I'm working, so.
Thank you, Commissioner. I have 4 things that I want to bring up. The first one is that on the 13th, tomorrow, is National Left-Handers Day.
Oh, wow.
On the 17th, National Baby Boomers Recognition Day.
Yeah.
On the 19th is National Aviation Day, so to Mr. Planzer being here and the job he's doing, the great job he's doing at the airport. And on the 21st, National Seniors Day.
Yeah.
Pretty soon we're going to have to get rid of National Baby Boomers because they all are seniors, so we can eliminate one off the calendar. But with all that being said, I would look for a motion to adjourn.
Motion to adjourn.
Motion by Commissioner Lubke. Second by Commissioner Franzine. All in favor signify by saying aye.
Aye.
Aye. Not in favor, same sign, or you can hang around. It's up to you. That motion passed.